The world was shocked 3 months ago when a couple of well-known celebrities took their lives just days apart from each other.
Fashion designer Kate Spade died on June 5th, and chef Anthony Bourdain died on June 8th. This week is National Suicide Prevention Week, a chance to talk about prevention and warning signs. And joining us now is Barb Cuppett, a licensed marriage and family therapist. Barb, thanks so much for coming in.
Thank you for having me.
Well, you just hate to hear about these high-profile celebrities' deaths, but one good thing that could come of it is perhaps it would allow all of us to take a good look at our loved ones if we know of somebody who might be struggling and see if we can get them some help, correct?
Absolutely. I think we need to increase the awareness so we can increase the opportunity for people to reach out and get support, and we can offer support to people we care about, our loved ones, people we work with, anyone we know that might be struggling.
What warning signs should we be looking for? What risk factors should we know about if we know someone that might have a potential problem?
One of the largest risk factors is isolation. So someone that is starting to pull away from things that are important to them or from people that are important to them, activities. Isolation is a significant one. Persons that have experienced significant trauma, have had significant loss, those are also risk factors as well. For children and adolescents, one of the things that has happened recently has been all the interest in bullying and the impact it has on children. So those children oftentimes lack support. And so for children that are being bullied or terrorized in that way is also pretty significant as well.
Why do you think men are more likely to complete suicide versus women?
I think sometimes it's the lethality of the method that they use, such as a gun or jumping off a bridge. Men do complete suicide more often than women, but women will attempt suicide more often than men.
How can we prevent this from continuing to happen?
Prevention is hard. Survivors that are left behind from those that have successfully suicided often have those questions about what could I have done to help with this. And I think to reach out when you notice a change in someone, you think that they're struggling, you want to care and help for them. I think we need to continue to talk about it. We need to decrease the stigma of suicide, of mental health, increase the supports, the opportunities to dialogue.
If someone is watching at home right now and they know someone that they love, that they believe might be struggling with depression or suicidal thoughts, what would be the first thing that you would suggest that they do?
I would reach out to that person.
What should they say?
Say, I want you to know how much I care about you. I think that I've seen you struggle, or I know that you're struggling, and I want to know what can I do to help you, what supports can I offer you, what services can we get into place for you, how can we help you get through this. It's okay to be struggling. We all struggle with things in our lives, but you don't have to do that in isolation. There are people that can help you.
Well, Barb, thank you so much for your advice. It's certainly an important topic on a week like this week.
You're welcome. Thank you.
Thanks for coming in.